Eating Matters program volunteers' roles and responsibilities. Arrive on time wearing a clean uniform and a name tag. Pick up the Eating Matters binder from the nursing unit. Collaborate with your team of volunteers on that day. Review the patient's assignment sheet list and work with your team of volunteers to divide up the assignment according to the number of volunteers and patients assistance required on your shift that day, whether it's setup, partial, or total feeding. Get to know your patient. Review the patient information sheet pertaining to the special diet, oral nutritional supplements, and required safe eating practices. Enter the patient's room, introduce yourself, and let the patient know that you're going to support them with their meal. Encourage patients to come to the dining lounge dressed in a clean outfit. Support your team in setting up the dining lounge area. Wipe down the table before the meal trays arrive. When positioning patients for their meals in a chair or wheelchair, follow the 90 degrees rule, where the hips, knees, and ankles are bent at 90 degrees angle with the hips at the back of the seat or wheelchair. Provide cover-ups to keep their clothes clean. When the meal arrives, check that the name on the meal tray ticket matches your patient's name and diet order. Please report any therapeutic diet errors to the unit dietitian. Read the meal ticket to communicate food items on the tray. Describe the type of food or texture received in an appetizing manner by making positive comments on the food's nice smell and different colorful combinations on the meal tray. This could improve patients' appetite and make them look forward to eating their meals. If some of the listed items are missing on the meal tray, call down the kitchen to report errors and obtain the correct items as needed. Provide supervised partial or total feeding assistance when needed. Assist patients with meal tray setup by opening sealed lids, containers, cut up food, add sauces or spices as needed. If your patient got distracted and stopped eating, try to reduce interruptions and redirect the patient's attention on eating and finishing their meals or supplements. Encourage patients to consume the high-calorie, high-protein items first. Promote finishing meals and oral nutritional supplements halfway or towards the end of their meals. Provide consistent verbal cues reminders specific to patients' needs. Watch for vision loss, rotate meal tray, move foods items closer to patient's reach and visual field. Discourage the patients from talking with foods or liquids in their mouth. Encourage patients to eat and drink as much as possible. Leave unfinished supplements, fluid, or thickened fluids at the bedside prior to removing the tray. Treat patients with dignity by promoting independence and encouraging patients to feed themselves. Maintain face-to-face contact and, whenever possible, sit at patient's eye level to convey social support and build a sense of trust and respect with your patient. Encourage and praise the patient when eating to promote increased intake and finishing of meals and supplements. Help with transporting patients to the dining area and back to their rooms after the meal. Safety IPAC protocols. Identify patients in isolation by checking the IPAC signage outside the patient room. Volunteers are required to gown and glove following proper steps of wearing and taking off their personal protective equipment. Remember to sanitize your hands each time you enter and exit a patient room. This will help prevent the spread of germs in the healthcare setting. At the end of the meal, complete the required documentation for the patient's meal intake found in the Eating Matters binder. Keep marked meal ticket in the calorie count envelope outside the patient room to be monitored by the dietitian when required. Any additional notes or information you are able to add will greatly assist the next volunteer. Protect patients' confidentiality by shredding any papers with patient's name, identifiers, or meal tray tickets prior to leaving the unit. Seek guidance from staff, other volunteers, or the nursing team as appropriate. Please inform volunteers team leaders if you're not able to attend your shift. Our patients and staff depend on you.